I am Dr. Hiroshi Takeda, and in this video, we are going to explore a topic that may surprise many: how something as essential as water can, in rare and extreme circumstances, become fatal. While water is vital for life, excessive consumption can lead to a dangerous condition known as water intoxication or hyponatremia, which has been documented in numerous tragic cases worldwide. Water intoxication occurs when an individual consumes more water than the kidneys can excrete in a given period, leading to a dangerous dilution of sodium in the blood. Sodium is a key electrolyte that helps regulate water balance in and around our cells. When sodium levels drop below 135 mmol, here's L, the body enters a state of hyponatremia, and the effects can escalate rapidly. Cells begin to swell as water moves into them, a process particularly dangerous in the brain, where swelling is restricted by the skull. The result can be a sharp increase in intracranial pressure, leading to seizures, coma, and even death if not promptly addressed. To understand the risks, it's essential to know how much water our body can handle. Healthy adult kidneys can process approximately 800 milliliters to 1 liter of water per hour, consuming more than roughly 4 liters per hour, about 6 standard cups, can overwhelm the kidneys and trigger water intoxication. Clinical observations suggest that symptoms often appear after ingesting 3 to 4 liters within a few hours, and in extreme scenarios, around 6 liters can be fatal for a person weighing 75 kilograms. Symptoms of water intoxication progress in stages. Early warning signs include headaches, nausea, vomiting, confusion, fatigue, and drowsiness. As hyponatremia worsens, neurological symptoms intensify, manifesting as seizures, severe muscle weakness, respiratory difficulties, coma, and, in the most severe cases, cardiac arrest. These manifestations are a direct consequence of cellular swelling and disrupted electrolyte balance, particularly affecting the brain. Several high-profile cases illustrate the dangers of excessive water consumption. Leah Betts, an 18-year-old in the United Kingdom, tragically died in 1995 after consuming approximately 7 liters of water in 90 minutes during her birthday celebration, following ingestion of an ecstasy pill. Misguided advice about hydration, combined with her impaired body's ability to handle such a volume, led to fatal cerebral edema. Jennifer Strange, in 2007, died in the United States after participating in a radio contest, Hold Your Wee for a Wee, where she consumed nearly 2 gallons of water in 2 hours. More recently, Ashley Summers, a mother of 2 in the United States, died in 2023 after drinking 64 ounces, 1.9 liters, of water in 20 minutes during a 4th of July event. Another notable case involves Sean O'Donnell, a 59-year-old father in Ireland, who died after consuming excessive water following medical advice to hydrate, highlighting that even routine guidance can become dangerous if intake is not carefully monitored. Certain populations are more vulnerable to water intoxication. Psychiatric patients, especially those with schizophrenia, may develop psychogenic polydipsia, a condition marked by compulsive water consumption. Endurance athletes are also at higher risk, as prolonged exercise can temporarily reduce kidney filtration capacity to around 100 milliliters per hour, increasing the likelihood of overhydration. Children and older adults with less efficient renal function are similarly susceptible, as are individuals taking certain medications such as diuretics or antidepressants, which can exacerbate water retention or alter electrolyte balance. The pathophysiology behind water intoxication involves a rapid decrease in serum sodium levels, leading to hypotonicity in extracellular fluid. Water then shifts into cells to balance osmotic pressure, causing cellular swelling. In the brain, this swelling increases intracranial pressure, impairing normal neural function. Initial symptoms: headaches, confusion, irritability, and drowsiness reflect early neural stress. As swelling progresses, More severe neurological complications like seizures, delirium, and coma can develop. Muscle-related symptoms such as tremors, spasms, or weakness arise due to electrolyte imbalance affecting neuromuscular function. Gastrointestinal symptoms like vomiting and diarrhea often accompany the condition, exacerbating fluid and electrolyte disturbances. Prevention is critically important, especially for older adults. Drinking according to thirst remains one of the most reliable indicators of hydration needs. Urine color provides an accessible gauge. Light yellow indicates adequate hydration, whereas completely clear urine may suggest overhydration. For those engaging in intense physical activity, particularly in hot environments, electrolyte-containing beverages should supplement water to maintain sodium balance. Distributing water intake throughout the day, rather than consuming large volumes in a short time, further reduces risk. Treatment of water intoxication must be prompt and carefully managed. In severe cases, medical intervention with hypertonic saline solutions is used to gradually restore sodium levels, avoiding rapid correction that could lead to additional neurological complications. Fluid restriction is also essential to prevent further dilution of blood sodium. Supportive care may include monitoring of vital signs, seizure management, and addressing underlying causes such as psychiatric disorders or medication effects. Understanding the balance between hydration and overhydration is crucial for maintaining health in older adults. While chronic dehydration carries its own risks, including impaired kidney function, cognitive decline, and increased susceptibility to falls, overhydration presents an equally serious, though less common, threat. Educational strategies should emphasize individualized hydration, considering age, kidney function, activity level, and environmental factors. Scientific studies highlight the spectrum of risk and provide guidance for safe hydration. Research in endurance athletes demonstrates that hyponatremia can occur when fluid intake exceeds renal excretion capacity during prolonged activity, even in otherwise healthy individuals. Military training has also produced cases of fatal water intoxication, reinforcing that strenuous exertion in heat, combined with overconsumption of water, can be lethal. In clinical settings, psychogenic polydipsia remains a recognized cause of water intoxication, with documented cases leading to seizures and death if untreated. It is important to note that there is no universal threshold for fatal water intake. Individual factors such as body mass, renal function, and concurrent medical conditions significantly influence susceptibility. For example, infants and children, due to smaller body mass and lower sodium reserves, are particularly prone to overhydration. Older adults, often with reduced renal efficiency and sometimes on medications affecting fluid balance, require careful monitoring of intake. Awareness of these risk factors, combined with education on the signs of overhydration, is essential for prevention. While water intoxication is rare, its consequences are severe. Key signs to recognize include persistent headache, nausea, vomiting, confusion, muscle cramps, and fatigue. Progression to neurological deterioration, manifested as seizures, extreme weakness, or altered consciousness, demands immediate medical attention. Temporary measures, such as consuming a small amount of sodium-containing food while awaiting help, may provide short-term mitigation, but definitive treatment requires professional intervention. Older adults should be particularly vigilant. Physiological changes with age, including decreased thirst perception and reduced renal excretion capacity, mean that routine advice to drink plenty of water may inadvertently increase risk. Healthcare providers should individualize recommendations, emphasizing hydration through both water and electrolyte-containing fluids, monitoring urine color, and spacing intake to match bodily needs. Equally, caregivers and family members should be educated to recognize early warning signs of overhydration and differentiate them from dehydration or other medical conditions. Misinterpretation can delay treatment and increase mortality risk. In psychiatric populations, particularly those with known polydipsia or cognitive impairments, structured monitoring of fluid intake is critical. In conclusion, water is essential for life, but like any substance, it can be harmful in excess. Water intoxication illustrates the fine balance between hydration and overhydration, highlighting the importance of personalized guidance, awareness of risk factors, and prompt recognition of early symptoms. Through education, careful monitoring, and adherence to evidence-based guidelines, older adults and vulnerable populations can enjoy the benefits of adequate hydration while avoiding the potentially fatal consequences of excessive water consumption. By understanding these principles, we not only prevent tragic outcomes but also promote long-term health, cognitive function, and overall well-being. The cases of Leah Betts, Jennifer Strange, Ashley Summers, and Sean O'Donnell serve as powerful reminders that even common, life-sustaining behaviors can turn deadly when carried to extremes. Let these stories reinforce the need for vigilance, careful monitoring, and respect for the body's signals. By applying scientific knowledge and practical strategies, we can safely enjoy the life-sustaining benefits of water without risking our health or our lives.